If you've ever been to the doctor and had an injection done by a doctor or a nurse and wondered after you were done whether or not those people knew what they were doing, I have your answer for you today. And also I have a few reasons for you why a doctor or a nurse should choose to give your injection into your vastus lateralis, which is your leg muscle, rather than your dorsogluteal, which is your rear. Typically, today what I'm going to demonstrate is I'm going to demonstrate a Z-trac injection, and typically injections are given to administer medications quickly. You can give an injection of up to 3 mils into a large muscle. Anything larger than that, anything more than 3 mils is going to cause increased pain and irritation at the injection site. During anaphylactic shock, which is a severe allergic reaction to anything a person could be related to or allergic to, bee stings, shellfish, peanuts, just as an example. Often an intramuscular injection of epinephrine is given into a large muscle to combat anaphylactic shock. Flu vaccinations are another example of an intramuscular injection given into the deltoid muscle. Another type of injection is subcutaneous injection, and an example of that would be an insulin injection. This injection is given into fatty tissue or adipose tissue onto the body. They can be given into the stomach or into the adipose tissue in the back of the arm. At one point, I had actually received an injection of an antibiotic, and it was given to me dorsogluteal, which would be into your rear. I actually was unable to walk without severe pain for about 6 hours after that. What had happened was they gave me about 3 mils of an injection, and the muscle that you put the injection into in that area is very close to the sciatic nerve, and the injection fluid can actually press against the sciatic nerve and cause severe pain, and it's a very painful muscle to give an injection into, so that's why these days they're usually using the vastus lateralis, and a lot of times you'll see doctors and nurses using that on babies as well. We'll get into the Z-trac method here, and I'll give you a demonstration on how a Z-trac injection is given. And the first thing you want to do is you want to wash your hands, make sure that you have clean hands, that you put gloves on. So the first thing you want to do is put on our gloves. And for this demonstration, or for an injection, you're going to need a few supplies. You're going to need a vial of solution, whatever your injectable is going to be. You're going to need a 3 mil syringe, which I have here. You're going to need a Band-Aid and a couple of alcohol swabs. And typically you would also need a needle. But for this purpose, I'm not going to use a needle. The first thing that you'd want to do is you're going to want to clean your vial, because there's going to be bacteria that harbors on the top of this vial, so you're going to want to clean that for about 10 seconds with an alcohol swab and discard that swab. The second thing you're going to want to do is identify the muscle that you're going to be giving the injection into, and to do that we are going to give it on the lateral side of the leg, which is the outer portion, and we're going to identify that muscle by putting a hand right above the knee and a hand right below the hip. And you're going to find that muscle on the lateral side of the thigh, just on the outside here, on the outside of the thigh. And you're just going to, you can choose it, you can pinch it, I mean, it's right there for you to see. The next thing that we're going to do is we're going to clean the area that we are going to be giving the injection into. So you want to take your alcohol swab and you want to swab for 30 seconds in a circular motion or back and forth. It doesn't matter as long as it's about 30 seconds. And we're going to wait for that area to dry, because you do not want to give an injection into an area that has wet alcohol on it, because it can cause more irritation to the injection site. So the next thing that we're going to want to do is we're going to open up our syringe, and we're going to prep our needle. And we would have a needle on this already. Many injections actually come preloaded. So what we're going to do with this, since we're going to load our own, is we're going to load about 2 or 2.2 mils of air into this needle, or into this syringe. And then we're going to actually pump this air into our vial, like so. Pump the air into the vial. And then we will actually draw back our solution from the vial back into our syringe. And we do this because it creates, if you don't replace the fluid that you take out with air, it'll cause a vacuum inside the vial. So we now have our 2 mils of pretend solution in this syringe. So what we're going to do is we're going to use the Z-trac method. And the Z-trac method is used because we want to be able to keep all that solution that we inject into that muscle into the muscle. Sometimes when we're using a larger gauge needle, like a 21 gauge needle, you're going to have solution that comes back out through your injection site. So what I'm going to do for the Z-trac method is I'm going to pull the skin backwards and sideways, or I'm going to pull it backwards, creating kind of like a Z shape. Okay? And so we are going to inject at a 90-degree angle. We are going to aspirate, pull back just a little bit, make sure the aspiration is so that we are not going to be injecting into a vein. We don't want to do that. So we see we don't have any blood return on aspiration, so we're going to inject our fluid, the full 2 mils, into the muscle. We are going to wait about 10 seconds. And 10 seconds is a little long to wait, but you can talk to the patient a little bit, and explain to them that it's just about done, you're just about ready to take out the needle. So we're going to take the needle out, and we're going to hold about 3 seconds after the removal of the needle, and then we're going to release. Now, after that, we're going to discard this into a sharps container. The point of the Z-trac method is to be able to keep the injection, whatever you're injecting into the muscle, in the muscle. So to review, we never want to give more than 3 mils into a muscle because more than 3 mils causes severe pain and irritation. We also never really want to use the dorsal gluteal muscle if we don't have to. Always want to use the vastus lateralis. And we always want to aspirate to make sure that we're not putting an injection into a vein. And we always want to use the Z-trac method just to make sure we have proper delivery of all of our medication that we're going to be delivering. So I hope that this demonstration has given you a little bit more of an idea of what actually goes on when a nurse has to prep and give you an injection.